So, welcome everybody to this interview with Dr. Alissa Wolf. I am really excited to be meeting with you.
I can't believe that it's been that long. That's just
It's true.
wow. Yeah.
It's true.
I have lived in Pennsylvania, California, Kansas, Hawaii, Iowa, and now I live in Texas. So I've been all over the place. Um, but in terms of my chronic pain journey, I did not come into this world through the experience of chronic pain. And I think a lot of people who do get into it are because they've had to live it. And so many people say, you don't understand chronic pain until you've been in it. And I think there is a lot of truth to that, except I've spent my whole career living and like trying to learn everything I can about it. And so I feel like I have an understanding of what people go through as much as I can without having been through it myself. But my chronic pain story, my background is I'm a doctor of physical therapy, and I was just really blessed in my education with mentors and professors and instructors and coursework to be exposed to chronic pain and specifically neuroscience. And so that really sparked my interest when I was a young clinician. And then when I was in the clinic, out in the real world for the first time as a physical therapist, I was seeing people not get better. I was seeing lots of trends with people with similar characteristics. And I was just like, this doesn't make sense. They're not getting better. What I was told was supposed to work for them isn't working. And so rather than just saying, screw it, let's just do the same thing over and over that doesn't work, it just sparked my interest. And so I wanted to learn more. So that's what I've been doing ever since. Like, I've just been constantly wanting to learn everything that I could about chronic pain. When it comes to specializing chronic pain, I actually started by specializing in orthopedics. And then in that orthopedics coursework, I learned a lot more about chronic pain, and chronic spinal pain was something that we did talk about in that coursework. And eventually, the leading pain neuroscience research group in the United States developed a chronic pain specialty program, which I ended up doing, which was brilliant. But yeah, so that's kind of been my journey. I always say that, I didn't really choose chronic pain as a specialty. It chose me. I feel like it's a calling. I've been, I think God has uniquely gifted me with this passion to help this population, with having these history of experiences, with having the mentors and just all of these blessings to put me in the position to do what I do and actually care about these people. And so I feel like it's a calling. And so I'm just here using those blessings that I've been given to help those people. And there's times, I'll tell you right now, there are times where I feel guilty because I didn't have to live the pain
Yeah.
experience to be able to help people. And so it's hard for me at times to be able to say, I know what you're going through. I understand what you're going through, because I personally don't from personal experience, but I try my darndest to feel, to go through that. And I don't know if you feel that way sometimes too, because maybe you feel guilty for not having pain and you have to watch others suffer. For me, it was initially like that imposter syndrome that I think I
Yeah.
felt. And then
Yeah.
eventually, with so many clients, so many people that I've worked with have actually reinforced it in me that I'm like, okay, I actually should not feel that way, because they've come and said to me, it's actually really refreshing to have someone who's not in this to be able to provide sound way of thinking, a different way of looking at it, a different perspective than just being bogged down in the emotional parts of it. And while I can understand the emotional parts of it, I can also be very clear headed and being these are the facts,
Yeah.
without all of the emotional parts, and just be honest and help identify roadblocks that I think people come across when they're dealing with this very challenging problem. So the way that I look at pain is that it's multifaceted. Number one, there is a structural and mechanical component to pain 100% of the time. I almost I would always argue there's always some kind of structural or mechanical component going on. And so, well, I'll go back to that. Yeah. So there's multiple parts of this problem. There's the structural and mechanical components. There's the psychological components of, the impact that it has. Like you said, it causes anxiety, it causes depression, it causes irritability. It messes with your sleep. It creates brain fog. All of these things start happening. So it definitely messes with your mood and your emotions. But there's this whole piece that the medical system doesn't address, which is the nervous system.
Mm-hmm.
And the medical system has a tendency to be very hyper focused in that structural and mechanical lens. So the treatments they provide tend to be mechanical based treatments, so like physical therapy, chiropractic care, surgical interventions, telling someone that they should lose weight. Those types of things are very mechanically type treatments.
Right.
Your joints get stronger, your muscles get stronger, help you with flexibility, range of motion, something mechanical or structural.
Yeah.
Or there's the other side of the medical system that is the, like, I want to almost call it the Band-Aid, because they'll treat the intensity of the pain, but they won't treat the root cause of the pain. And so they'll give you some kind of a medication, like a gabapentin, like some kind of nerve pain medication, or an anti-anxiety medication or antidepressant or a painkiller, an opiate, or an opioid. All of those things have a tendency to just be the Band-Aid. They're just going to mask the symptoms to help you feel better. And there's absolutely a role for that. So in no way what I'm saying is like we should get rid of that stuff.
Right.
But those things play a role. But unfortunately, when you go to the doctor and they can't really identify, when they say to you, like, it doesn't make sense why you're in this much pain. Like, your x-rays and your MRIs don't really show like all of that going on. We don't really know what's wrong with you. So because they don't have an understanding of that nervous system component, all of the attention just gets shifted to the psychological realm. And so they're like, well, if it's not mechanical or structural, then it must be all in your head. Go see the psychologist and go get your head right. Maybe don't worry so much.
Mm-hmm.
Maybe you should stress less, like that kind of stuff. And that in itself is a huge problem, because that feeds into the whole cycle, gaslighting and all of that. So for the record, when I talk about nervous system stuff, that does not mean it's a thinking problem. That does not mean it's an emotional problem. It doesn't mean it's all in your head. It doesn't mean you need therapy for your pain. Again, going back to what you said earlier, everyone needs therapy. Go to therapy. It's good for you. Do it. But at the same time, don't expect the therapy to rid you of pain, because there's another part of the problem happening. There's a whole nervous system in there. And I don't care what kind of pain you have, like how it started or where it's at, you have a nervous system. So if your pain has been around for longer than 6 months, you have changes in your nervous system that are causing and contributing to the pain problem. And that again, does not mean it's in your head. Right. And so, when I say, like, you asked me, like, how is what I do different, or how I view pain different? I think because we've been so hyper-focused in the structural and mechanical realm, I'm over here like, let's zoom in on this piece, not ignoring the other parts of that puzzle, because they're very important.
Right.
This is another part of the problem that we have not been addressing, and we can address it. And so that is where sort of my focus is and where my approach is. I'd like to say that the pain neuroscience research is new, but we're talking now, it's like some of it's like 20, 30 years old. So it's not like it's that new to where we can still use that excuse anymore. When I first started in this field, I could have said, like, oh, this is newer stuff. And so it makes sense that our doctors don't know about this yet. But our doctors don't know about it because it's not a required part of the medical school curriculum.
Okay.
None of the universities, I won't say none of the universities, like most universities in terms of like medical schools, have 1 hour of coursework on chronic pain neuroscience. 1 hour. That's like one lecture. So that is, I've been doing this for, I don't know, almost 10 years. So, and I'm still learning. So I don't think they're taught enough about it. And then they're so it's not required in their coursework. When they get out into the field, when they do their residencies, if they were exposed to this science, when they get out into their residency, they're now being taught by instructors, or whatever they're called, attendees, who probably also haven't been taught about this stuff. And when you're a new doctor, you mimic those around you, your instructors, you learn from them, and and so unless you're somebody who questions and is really standing up for what you've learned and we're taught about the nervous system, I think it's going to be really hard to start to incorporate anything that you've learned.
Mm-hmm.
I think that there are doctors out there who have been exposed and have an understanding of this stuff to a small extent, but don't have the time to really talk to people about it. And so what I've heard in some of my conversations is that people will say, my doctor said my nervous system is sensitive, and my nervous system is out of whack and stuff like that. And I think when they don't have enough time to fully explain it, or don't have enough information themselves to fully explain it with kindness and compassion, it can come off as like you're sensitive, and like it's some kind of it sounds bad when not taught the right way. And so I think that is another component for those doctors who do know something. They don't have the time. Like when you go to the doctor, how much time do they have? Maybe 15 minutes at best. But I used to work with a doctor who saw 4 patients every 15-minute block, which is like, I think 2 to 3 minutes per patient. That's not enough time to
Yeah.
tell anybody anything, really. So they don't have the time. You mentioned neurology, and I think, if you're looking for a specialist in this stuff, I get that asked all the time, like, what kind of specialist should I go to? A rheumatologist, an endocrinologist, a neurologist. They sound like the right people to go to, for
Yeah.
sure. And they definitely go see those people. Not saying don't. But yeah, your neurology, they're going to come at pain problems with the tools that they have to provide for you, which is oftentimes medications or injections or surgical procedures. They don't have time to educate. And so when we look at what is the actual treatment, the actual treatment starts with education, and then it progresses to teaching you what you can do for yourself. And so when you look at why don't we see this stuff happening in the medical system, it's because education is not reimbursed by insurance companies. It takes time, but what does pay are those big procedures, the injections, the medications. That's where people get paid. They don't get paid to spend time teaching somebody how to take care of themselves and how to address the problem from themselves. And when we talk about what can you do, what is the treatment? Can you actually cure pain? We can debate that. But
Okay.
it has to do with, when we want to address the nervous system component of the problem, it has to do with what you can do on your own. I can't fix it for you. You know what I mean? Like, I can show you what to do, but I can't make you do it. And so I think the medical system is very much of that. We'll give you a passive intervention. We'll do it to you, or we'll give it to you, versus me teaching you how to do it yourself. And so there is that difference. And I think that's why we don't see this happening in our medical system as much as we should be. And then I think you were asking a little bit about what can you do, or
Yeah,
yeah.
and real quick before we get, so just going back to the neurology, what are just a couple of examples of something that the neurology focus mostly on? Did you say something that they're gonna try to deal with things that has to do with more straightforward surgical stuff like epilepsy, things like that? They're not gonna get into. I mean, what are some examples of where that's a really good fit for a neurologist?
Nerve damage, nerve injuries, um, depending on the provider. Like, I know that some doctors will do, the pain management doctors will do some of the same things probably that some of the neurologists would do for pain management wise. So nerve blocks, RFAs, injections, like spinal injections. Like, so neurology can do some of that stuff. They can test your nerves to find if there's actually like a nerve injury, if there's somewhere along that nerve where that thing is injured, whether it's permanent injury or uh, permanent injury, or um, something that you can recover from, and stuff like that. They can do more in-depth evaluations of like brain stuff. So if you're having headaches and
Mm-hmm.
that kind of thing, looking for red flag stuff like um, I was just on a call today, so it's on my mind, of like a CSF leak, a brain leak, a spinal fluid leak, and that can cause lots of pain, MS. So they can help identify some of those pieces.
Mm-hmm.
And, in terms of treatment, it's going to be surgical or injection or procedure in some way.
Clearly, you or someone like you can come in to make sure that they're getting education that's lacking. You have a new patient, they're feeling optimistic, they're still going to maybe be uh, getting various kinds of care from some of those experts, but they're really drawn to what you're saying. They're getting education, they're getting bedside manner that they haven't before. They're feeling like, wait a minute, we need more like Alissa. uh,
Mhm.
where do you lead them to that?
Yeah. It's funny you mentioned that, because I just did a podcast episode that I think really would. So I'll summarize that for you. How about
Yeah.
that? So there's really, I mean, it's a process. I like to say, like, so a lot of people want to come to me and they ask me like, just tell me what to do. I'll do it. Like, and I want to be able to tell people that. I really do want to just say like, here are the things you should do. Just go do this drill and you're going to feel better. But it's not that simple, because this solution to this part of the problem is not a simple drill or an exercise. It's the whole system that you really need to put into place to be effective. And so, yes, the education piece is comes first, because people need to know what is wrong with them. They need to understand what kind of problem they're dealing with in order to feel safer in their bodies. That is like step one. You see so many people, I'm sure you've experienced this in your conversations with people, is that the journey to get the diagnosis is such a fight, but people need to have that understanding of like, what's going on in my body. Because when you don't know the kind of problem you're dealing with, you don't know what is safe and what's
You're
not
not,
safe.
yeah, you're not,
Everything feels dangerous, right? Like, I don't know if moving this way is bad. Is this thing bad? If I eat this, is that good or bad? I don't know. Everything must be bad, because nothing feels safe yet until you know what it is. And so, yes, getting a diagnosis is very important for a lot of people. But even those diagnoses, like sometimes I get people saying like, I have fibromyalgia and I don't know what that means. It's like, okay, well, now we need to explain. Like, we
yeah,
need to understand what that means and what is happening in your nervous system. Even if you don't have fibromyalgia, if you have a disc bulge, what is actually going on beyond just the disc bulge? What else is happening in your spinal cord and your brain? Because that is a big component of that. So education is a huge component. And what I would just say to anyone listening, the education sometimes gets better results than the drills themselves. So like, I have people in my program who go through the education and are already seeing huge improvements in pain and functional ability, are able to start moving more and get back to exercising before ever touching a single drill, which is fantastic. So education is very powerful in healing. Um, but then in terms of like, what else can you do? The doing parts. There's a whole slew of like foundational strategies that you want to incorporate. Because you have to go back to the basics to some extent to really set yourself up for success for the rest of the process. Um, and so I have a few foundational strategies that I talk about, and I won't really go into depth on each and every single one of them, but breathing drills is a really good one to start with. It's very basic, very fundamental. And trust me, anyone listening, I know that breathing drills are not going to cure your pain. Okay, I'm not saying that whatsoever, but it is a very vital tool for the rest of the process. Sleep is also a very important part to have on board, because if we're talking about changing the activity in your nervous system, you have to have sleep on board. And I know that almost all of y'all with chronic pain struggle with sleep. And so we have to work on that piece to help your nervous system repair itself and change itself. We need to be, I kind of went out of order here, but we need to be looking at your goals and what you want to work towards, because we can't just say, I want less pain. Why do you want less pain? What do you want to be able to do? What are you limited with now that we need to change and work on? So we have to have that in mind. So we're working towards something and not just the goal of pain relief. And the one thing I'll say about that is that when you have the goal, it determines the action steps. So if your goal is relieve pain, if I ask myself, what are the action steps that I'm going to do to relieve pain? It's going to be things like a heating pad, a TENS unit, medications, injections. Those are all very passive things that aren't going to have any long-term effects. And so if you change that to, I want less pain so that I can ride horses again. That was the first thing that came to my mind. I don't know. I want to ride horses again. Did Nell ride horses?
No, no.
Okay, darn. That would have been really cool. But anyway, yeah. So if like I want to ride horses, then okay, great. Now we have something where we can actually be strategic about how do we get you back on that horse? What things do we need to do first before we can get you there? So we need the goal. There's a lot of mindset pieces that we need to work on. And again, guys, I do not mean like we need to try to convince yourself that you're not in pain or like have toxic positivity. Like none of that is actually helpful for you. It's more of the things where, you know, all of us perfectionists have the all or nothing mindset. And we're like, we have to do it right 100% of the time. It has to look like this. It has to be perfect. And that is one thing that I have to constantly be working on with people in my program, is because this is not an all or nothing, black or white process. There's so much gray area, and we need to be more comfortable operating within that zone. So mindset is a piece of that. You know, fear is a big piece of this. There's a lot of fear of movement. There's a fear of pain. There's a fear of flare-ups. There's a fear of like, what if this doesn't work? What if it never works? What if I never get better? What if I get worse? So all of those fears, as part of that, we need to work through the mindset piece. And then the last foundational skill is really flare-up prevention and management, which is probably the biggest piece. So we have to have the ability to predict and prevent flare-ups. A lot of people, again, they come to me and they say, how do I get out of a flare-up? How do I manage my pain when I'm flared up? And that is fine. There are definitely ways that we can improve your flare-up management when you're in the flare-up. But it doesn't make sense for us to only work on ways to get out of a flare-up and then continue living the rest of our life on a day-to-day basis, pushing ourselves into that pain again. The point is not just to get out of pain, but it's also to learn how to not be in pain. And so flare-up prevention strategies, predicting and preventing flare-ups, is a huge component of that. And so that is something that we work on continuously throughout my program and throughout my approach. So those are the foundational strategies. Those are just like the building blocks of like things we need to have in place. And then nervous system retraining is like the next piece of that. So I already mentioned the educational component, learning like what is happening in your nervous system. And then we have the retraining drills to address those changes in the nervous system. And so when I teach like the pain neuroscience, I'm teaching one part of each little part of the pain problem one at a time throughout the nervous system. So it's not like there's one big change that happens in your nervous system. There's multiples. It happens there's changes in the peripheral nervous system, in the spinal cord, there's changes in the brain. And they're not like we do one thing and it just solves all of those problems. We need specific drills to solve each part of those problems. And so I teach what I call bottom-up techniques that help to retrain the nervous system from the bottom up, or help reduce peripheral nerve sensitivity. And we teach top-down strategies that help to essentially retrain the brain and the whole nervous system from the top down. And so we do brain-based drills that are really hard for me to explain, because they're not like anything that anyone would like automatically assume. When you hear brain-based drills, I think of some kind of like meditation, or like, I don't know what I think. There's something out there, and it's really not that stuff. They work because they activate mirror neurons in our brains. They get our brains comfortable with performing movement without actually performing movement. And so it starts to separate pain from movement. It helps to strengthen up our brain's processing ability. So when the spinal cord sends a message to the brain gets the message and it goes, I know what that means. That's danger. Or, oh, that's not danger. We're wearing pants. Instead of the brain constantly getting that message and going, oh shit, I can't, I'm sorry, I'm not supposed to say shit. uh, Instead of the brain kind of getting that message and going, I don't know. I could be wearing pants. I could be in a lot of danger here, but I don't know. And so the only thing that I can do safely is to assume that it's the worst case scenario and protect you. And so the brain based drills help to change that processing ability of the brain so it can correctly interpret those messages. And to be clear, that does not mean that we're teaching your brain to not listen to pain. We're teaching your brain to correctly interpret the messages. So when it's truly pain, like danger, injury, the brain can go, danger, injury, we need to go to the hospital. Or, oh, we're just wearing pants, disregard and move on. It's nothing to react to. So the brain-based drills do that kind of thing. I could talk about that all day, but I won't. Uh, and then we have the whole movement and activity component as well. And so pacing is like number one, we need to be pacing because when you have pain, you're either pushing through pain and overdoing it constantly all the time, which is not good for your nervous system. Don't listen to anybody, doctor, physical therapist, average Joe, who tells you to push through your pain, that the exercise is working when it hurts. That's bullshit. Sorry, I keep saying bad words. I get fired up. But yeah, no, don't listen to that because it's only reinforcing pain in your nervous system and that making it harder to break up with down the road. So we have that push through it, overdo it mindset. And then we also have the completely avoid it and don't do it kind of a thing where we compensate, we immobilize, we try not to use it, we ignore the body part. And that's not healthy either because that actually causes one of the changes in the brain that make things worse. So we need to find that happy medium of like not overdoing it and not avoiding it. And so that's where pacing comes in. Pacing is incredibly powerful and it's not easy to do. But I try to teach a very simple pacing strategy to get you moving better and more active and stuff like that. And then, of course, you've got to have the stretching and strength and stability components still as a part of your process, because no doubt, like when you have whatever kind of pain you have, if you have nervous system stuff or not, like you're going to have muscles that are weak, muscles that are stiff, joints that are tight, you're going to have range of motion stuff, like all of that stuff is still a component. And so really understanding how to stretch, like the principles of how to stretch and how to incorporate strength and stability drills into your plan through the lens of someone with chronic pain. Because how you stretch or strength train when you have chronic pain should not look the same as a bodybuilder or somebody who doesn't have pain. It should not be the same. So learning that principle of how to do that and incorporate that into your strategy as well when your body is ready for it, because not everybody is right off the bat ready to jump right in and start doing aggressive stretching and strengthening. They may need to spend more time in the like nervous system retraining and calming things down first before they can dive right in with some of those things. But also like recognizing when your body is ready for that and starting to pace your way into it, which is really important too. So those are the elements of what I would walk you through as fast as I could possibly tell them to you.
No, and before the interview, we're going to make sure people know how to get a hold of you for those that want to, learn more details. But some of the things that go on in my mind as you're kind of talking is, of course, if you start giving the attention, the education, the care that people aren't getting in each of these other areas, and it gets to where you've decided to not specialize in it. Like, say, for example, they are working with a physical therapist and they're having success with it, but you know they want to have your attention and services to help supplement what they go back and kind of so it sounds like that there could be both a collaborative kind of approach where you're not trying to do everything that they're not doing right or whatever, but and maybe there might be some that you take on yourself. I don't know. So I'm kind of interested on at what point would you say, oh no, we let's bring that in. We can actually, do some of this and not be with some of these other experts versus I want to supplement and kind of be an advocate, and then that helps you to be more educated as you work with some of these other experts. Does that make sense? Do you,
Yeah.
do you find yourself in that dynamic where you're needing to decide at which point you kind of help guide them to leverage some value that they're getting and not try to reinvent what you
Yeah.
know
And I had to be very careful about like providing medical advice, and I'm not allowed to provide medical advice, or in my program even like physical therapy advice. And so I'm very clear upfront and open when people sign up or start working with me that like do not come to me for physical therapy exercises because we're not doing that here. Do not come to me for psychology to be your counselor. You're still going to need you should still go to a counselor. You should still, like, if you're doing physical therapy or you're planning to do physical therapy, still do that. um and so like if you're I have people all across different, like, who are currently doing different treatments. So like, we've had people who've had injections, we have people who are currently on different types of all kinds of medications. um I've had people who have had surgery in the middle of working with me, people who are I think I already mentioned that physical therapy, they're doing PT concurrently at the same time. um, and so yeah, it's much more, I wouldn't say supplemental, it's more complementary, because I'm not trying to replace anything
yeah
that the medical system is already providing. I'm complementing it. And I like that you said more of the advocate. I'm more of the advocate and the informer. And so like, because I have a much more peer like relationship with the people that I work with. I don't like, it's not like you get to see me once every 6 months and we talk for 3 minutes, and like we actually get to form a relationship. We get to be more,
yeah
closer level, I guess. I don't know how else to put that, but like, um, we have a closer relationship. And so a lot of times people are asking me like, what are your thoughts on this? What is the science behind like ketamine infusions, for example, or what do you think about low dose naltrexone? And I have to be very careful. I'm like, I'm not providing medical advice, but here's what I've seen, and here's the science. Here are the risks. Go talk to your doctor about this. Like,
yeah
it's still like all of that is still within your power to be utilizing all of those tools. If you need more information, if you want to talk more about that kind of stuff, I'm here to have those conversations so that you can make the best informed decision for you. But I'm not here to supplement or replace anything like that. It's definitely very much complementary. And I think in that regard, it's like you said, I think I'm just filling a hole that the medical system is not addressing at this
yeah
point. The journey of chronic pain, and I hate that I have to define the population I work with as the chronic pain population, because we could probably prevent people from being in this chronic situation if we had the right infrastructure or whatever, the right referral system. If we had this set up, we could
yeah
probably avoid
world right
a
yeah
lot of people
for
hurting.
the one building and it anything that you could ever need short of a miracle you're going to get there and it's easy and you don't have to search for it and they're just going to meet all your needs.
Yeah.
Society's not like that.
Right. And I think, speaking back to what you're saying about like the journey of like, we have this very high expectation of like, okay, I'm going to go to the doctor, I'm going to figure out my problem. And it is this like roller coaster of highs and lows. I've seen it over and over again where like, and I think it's partly because we hold our doctors on a very high pedestal in our minds, like of like the hierarchy of like who's the smartest people. Our doctors are like up there, very high up there. And so like we expect them to give us an answer. We expect them to have the utmost amount of compassion and understanding towards what we're feeling. And so you make the appointment, you probably wait a little while for your appointment, depending on your insurance and where you're living and how busy your office is. Wait for that appointment. You have your hopes up, and then boom, you're disappointed. And then you wait a few more months, and then you go back and you're like, guess what, doc? It did get worse. I'm here again. I still need help. That thing didn't work. You tried. Let's go to a specialist. So you wait again, and you get another specialist referral finally, after jumping through the insurance company's hoops and waiting for the specialist appointment, maybe months at a time, like months down the road. Once again, your hopes are creeping up, and you're like, oh, I'm going to the specialist. I'm going finally to see the neurologist, or I'm finally going to see the rheumatologist. I've got my hopes up to get my answer, and then bam, you're back down again of that disappointment. Yeah. Like, knowing what I know about the nervous system, I always bring it back to the nervous system because that's what I do. But like, that absolutely contributes to the experience of pain. It contributes to these changes that happen in our nervous system. And as simply as I can put it, without really getting into the nitty-gritty neuroscience, is that like our bodies, like our nervous system's job is to keep you alive and protect you and help you survive and keep you intact. And so again, we were talking about like not knowing what the problem is. If your body doesn't know what the problem is, it assumes that everything could be potentially dangerous. And so when you don't know what the threat is, or your nervous system doesn't really know, and that's very vague, but it's going to ramp up its ability to protect you. It will, like, it is an adaptive response. What becomes maladaptive, but it is an adaptive response that your body is like, we need to really protect you. We're going to make ourselves better at protecting you. So we're going to make these peripheral nerves more sensitive. We're going to cause a change in the spinal cord that's going to make more messages come up to the brain. And all of these things start happening as a protective mechanism. And the more that medical system contributes to that roller coaster of not giving you answers, of gaslighting, of telling you like, how could you possibly be in a 10 out of 10 pain? You don't look like you're in pain. Like, all of that ramps up that protective response. And our nervous system says like, no, I'm serious. Something is wrong here. And it's like literally your nervous system gets better at being in pain, and it gets louder and louder. And so as much as that system is designed to, or intended to, we all took an oath, right? Like, to help people, it's hurting people. It's absolutely hurting people. I think things are going to change very, very slowly. I think since I really stepped out into this field, which I didn't really step out, it just kind of found me. But anyway, like, since I started out, there is much more awareness now out there about like the nervous system stuff. And I don't know if it's just because I do a lot of my outreach and like education through social media, but I'm seeing a lot more of that now on social media, a lot more people talking about it. Yeah. And I think that is because it doesn't have a home yet in the medical system. And so alternative, if you want to call it alternative therapies, is like, that's wherever you go to find that, that's where this is at least for right now. In this discussion, my aim for being here and chatting with you and all of the whole audience is not to like self-promote and be like, look, guys, join my program. Like, I don't care if you do my program, if you do somebody else's program, if you do nothing at all, but you just learned something today where it's like, oh my gosh, there's more to what I've already understood, then you are like, the seed has been planted, and you are now like free to move forward in this world with new information. And that is vital to that healing process. And if this, oh my God, that would be so cool to hear if like somebody was listening to this today or anything, and they were like, I feel like I'm out of options. I'm literally at the end of my road. There's nothing else I can do. I saw somebody in the chat say, I'm medically tapped out. Like, if you're at that point, like, I want to say to you, like, you're not. You haven't tried everything. Yeah. And, I've got options. There are options. It doesn't have to be me. There's other things out there that you can do. And that's what I would hope to inspire hope for that. I don't have a team. It is just me right now. And it's a lot of work being by myself. But I don't know. I've debated back and forth whether or not I want to build it up into a team. I do know that I need support in just business administrative type things. But in terms of like, do I have other coaches that work alongside me? The only downside is that when I bring a team on like that, I then have to raise prices, and I still want to make this
Yeah.
available because I know how this affects people's ability to work, and they're on disability, they're working part-time, they're not able to work. So I don't want it to be an astronomical price. Um, I want it to be somewhere where it's affordable, but also like is worth it for me. I need to have more faith in God and like his plan, and like, things are going to change.
Yeah.
It's been like the years of being in the medical system and being like so just disappointed. And that's why I'm not in it anymore. but
Yeah.
but like I shouldn't have that mindset of like it will never change kind of thing. That's not fair because even in my own journey, it has been like every single step of the way, God has provided the right steps, the right experiences, the right training, the right people, the right patients for me. Because, like, even for me, like, I would not have stepped out of my comfort zone of doing what I knew and what I've always seen had I not had the right people to work with. So, like, having the right patients put on my schedule who were like, I'm willing to try that with you, even though you don't have a freaking clue what you're doing and you've never done it before. You've only read about it in a textbook or on some lecture, but let's try it. Why not? And so it started with that. And then it started with, other patients and clients along the way who paved that path and proved to myself that I could do it. And not I could do it, but I could teach this and it was effective.
Yeah.
And so like every little piece of that story for me is so beautiful to look back on and see that God was coordinating. He was choreographing the entire journey. And so like I'm just here right now, like what's to come.
Yeah.
Who knows, I mean,
Yeah.
if
It's
he's doing
true.
that in my life, how else is he choreographing this whole thing to transform people? He wants people to heal. Well, first of all, thank you. This has been actually a really, really good discussion. I've enjoyed it myself. I always love talking about these topics. If we were going to come back on, let's do it. And hopefully not be next year. We'll do it sooner.
No, I know.
But in terms of like advice, it's easy for me to be able to say like, hey folks, like just have hope and like, provide some kind of like cheerleading message, like really like super inspirational. It'd be easy for me to do that. All I can say is like, I know that it sucks where you're at. It sucks that you've been having to put up a fight for your care, for the attention that you deserve. That sucks. And you deserve better. That's all I can say to that. Like I don't want to cheerlead you on. But question things, like definitely question things that doctors tell you, because not everything that they say is like perfect for your condition. Like just push through it and do the exercises and work harder and suck it up and you're not really in that pain. And something really is going on in your body. It is not in your head. It's not a thinking problem. It's not a mood problem. It's not a problem of your emotions. It's not a problem of your trauma, even though that's part of it. But yeah, that is the feelings you have and the experience that you have of pain is valid and it's real and it sucks. And you deserve better care, and there is better care available out there. It's just at that point yet where we haven't integrated in our medical system yet. It's
Yeah.
coming at some point. We're
Right.
manifest that. um, in terms of, there's lots of different ways that you can, if you're interested in learning more about what I do, how I work with people, or the approach just in general, not even like working with me. I have lots of ways you can connect with me. You can follow me on TikTok. I'm at Pain Crusader. You can follow me on Instagram at Pain Crusader. I have a free Facebook group where I do videos every week, long form videos, explaining pain neuroscience tidbits, tips, information, working through different elements of the pain problem. I have a podcast that's called The Chronic Pain Breakup. You can check that out and start learning there. All of that stuff is free. I do have free resources as well, like free downloads, like a flare-up toolkit and a pain and symptom scale. So if you want any of that, just send me a DM wherever. Probably on Instagram is the best way to get a hold of me that way. And then I do free phone calls. I call them the chronic pain. What do I call it? A pain care audit, which is like a phone call where we can look at what you've tried, what your pain is, what you've tried, and evaluate what other things you can still be doing to have an effect on your pain. um, and see, like, if a nervous system approach would be a good fit for you, and what does that look like, and answer any questions that you have about what that process involves. And then, of course, I have my program. My program is called the Chronic Pain Breakup Method. It's a 16-week program. But I have more than one way that I work with people. So if you're interested in any of that, the best way to have a conversation is just either message me, or we can talk on the phone through that, like, pain care audit phone call. So lots of different ways that you can get connected and get free information, free resources, learn a lot. And that's the last bit that I'll say, because this is not something that's super well integrated into the medical system. Unfortunately, you have to be the proactive one to take the step to want to learn. So, it's one thing to, I don't want to call anybody out in the chat, but I might. Like, it's one thing to say, I've tried everything and I'm super skeptical, so prove it to me. But then not actually go and, like, listen to what's out there and what we have to say, like, I don't want to sit here and just convince you. I want to show you the science, but I can't do that unless you want to take that proactive step and go out and learn. And so, unfortunately, that's the way things are. You do have to be the proactive one to want to learn it and want to do the stuff. But, if you take that step, healing and transformation is possible. So, just, it's there, it's within your reach, it's available for you. Those opportunities are there. Just go out and grab them. That's all I can say. So, yeah.
Oh, I love it. So you're saying one of the best ways is follow you at Pain Crusader on Instagram and then send you a message, or is there an email rather?
You can send me an email. I check my email every day, well, weekdays.
What's your email address?
Coach, COACH, at AlissaWolfe.com. That is ALISSAWOLFE.com.
Can't thank you enough, Alissa, for joining us. For sure, we're going to have to do it again.
Ain't you, like, tolerating how long it's taken for me to get this set up? So it was worth it. And everyone who's tuning in and listening, yeah, you guys are awesome.